How is everyone doing this evening? Given that it's Mardi Gras, I chose to dress very festively. I call this jacket overcompensation. Oh, no, we're ready to go. Dope. Okay. Has anybody heard of ketamine? You're not on a list or anything. I was just kind of curious of what our familiarity is. But just because I'm going to be very inappropriate tonight, I have to establish some credibility. So here's a little bit about me and who I am. I have a bachelor's in psychology, master's in counseling, a PhD in mind-body medicine with an emphasis in integrated mental health. I teach graduate counseling at St. Edward's University, undergraduate psychology at Houston-Tillotson University. I'm a preceptor for Preceptor Point, so I train psychiatric nurse practitioner students on the therapeutic approach. I'm on the board of directors for the Association for Applied Therapeutic Humor, and my most recent publications was a qualitative study on the experience of ketamine-assisted psychotherapy for treatment-resistant depression, and this year I'll be co-authoring a chapter on playful pedagogy in higher education. And if it's not evident, I'm still desperately seeking my parents' approval. And I know what you're thinking is like, Patrick, how do you have such an impressive resume and you are still single at 35? Well, to that. So anyways, ketamine is among many of psychedelic therapies that are available on the market. So we're all familiar with ketamine. There's also psilocybin. Does anybody know the more recreational name of psilocybin? Oh, don't act like you haven't done it. There's mushrooms. Some of you are on first dates and not wanting to admit to it, but yes. Magic mushrooms. We have MDMA as well, LSD, and ayahuasca. So all of these right now are either being actively practiced, mostly in other countries, because I don't know if you know this, the United States is a little bit behind on things in terms of that make us uncomfortable of our puritanical roots. But they're either in research phase or they're actually being applied clinically. In fact, Australia is the first country, I believe, in the world to fully legalize, decriminalize, and apply all psychedelic approaches to both medical and mental health infirmities. So really cool stuff going on over there. So ketamine itself is a pharmaceutical drug very similar to the effects of PCP. For you more sciencey nerds, it acts as an NMDA antagonist, which is more affiliated with its properties as a pain management or pain blocker. It creates a state of anesthesia known as dissociative amnesia. So you actually have this out-of-body experience. Now you can see why it's used recreationally. It creates a sense of euphoria. Also has analgesic effects, which is like more of a pain blocker in addition to the pain modifier or pain manager. It also has just natural anti-anxiolytic and antidepressant effects. So that's not just during the duration of the drug in your system, that's also for a few days to a few weeks after. That's why as a treatment, it does kind of give this misconception that after one or two sessions you leave and you're like, oh shit, like I've cured my mental health issues. No, that is just the chemical reaction your body is having. The actual therapeutic long-term benefits, which we'll talk about later, is coming from the therapy side of ketamine-assisted psychotherapy. So yes, you will initially feel better, but those are very temporary side effects. And it's considered a safer anesthetic due to just like the natural analgesic effects, but also it leaves your heart rate and your breathing unchanged, which we'll talk about a little bit in a second. Obviously, there are recreational uses. Anybody familiar with the recreational uses? No one's fallen for that trick? Okay, good. But it's known as Special K, Kit Kat, Cat Valium. That is my second favorite label. Super Acid, Special LaCoke is my #1 favorite because imagine just going up to a very hardened criminal and ordering some Special LaCoke. Purple Jet and Vitamin K. So you saw this more around like the late 80s, early to mid 90s. It's still being used recreationally today, but that is when it
barriers to access in a little bit, but the fact that the FDA hasn't fully approved it, which means insurance doesn't cover it, which means it's fairly cost prohibitive at the time, because it's still awaiting larger phase 3 clinical trials. So a little bit about the history. It was originally used as a battlefield anesthesia. So during the Vietnam War, we had to go out there and rescue soldiers and rehabilitate them wanted to knock them out so we could do some battlefield surgery if we needed to, but we can't take all of the equipment and all the luxuries that you have in a hospital. So it was very important to have an anesthesia that did not affect heart rate or breathing. So you can't have somebody go into cardiac arrest in the middle of the battlefield. So this was the best way to do this, even though kind of sent them down the K-hole and just made the whole battlefield magical, but not typically what you think of when you think of war. It's still used as an anesthetic in medical settings today, and it's also used as a chemical restraint. Is anybody familiar with the term chemical restraint? So people that are kind of bouncing off the walls, people that are a little too aggressive, either EMTs use it, or when I worked in psychiatric hospitals, it was more commonly known as booty juice. Don't recommend Googling booty juice, you will get a completely different result. It's also used in veterinary medicine. Some of you might have thought, as soon as you heard ketamine, the first thought you had was what? Horse tranquilizer. That's everyone's go-to thing for some reason. Everybody really hung up on that. But it is, in fact, a horse tranquilizer. And it is not only used for horses, but many other animals. But yes, it is used in veterinary medicine. And it's also adorably used in pediatrics as an anesthesia as well. So if you've ever seen a baby in a K-hole, probably the most adorable form of a baby, because they're just kind of like... the only contraindications with infants, because it does seem a little intense to use an active psychedelic with pediatric populations, but neurosurgery is the only contraindication. It's safe every other time. And the only reason it's contraindicated with neurosurgery is because there is a very, very, very slight risk for neuroinflammation. And that's the only other reason why it's not used more often. In mental health settings, it is approved to be used to treat major depression, but also treatment-resistant depression, bipolar disorder, PTSD, and then we also see it with pain management, addictions, which seems a little interesting to use a psychedelic drug or any drug in terms of treating addiction, but we'll get into that a little bit later. But the thing to keep in mind is that this should be an advanced option. If you're feeling some depression, if you're feeling some sadness, if you're feeling just some moderate impact to your quality of life, this is not your first line defense, because in mental health, just like in medical health, you always want to move from least invasive intervention to most invasive intervention. So even though psychedelic therapies are fun, they're safe, there's very little chance for side effects, it is still a very invasive procedure, which we'll talk about what that looks like in a second. But this is not your go-to thing. And in fact, the efficacy rates of success is 55 to 75%. And some of that is just an inappropriate use in terms of people just want to go get high, essentially. People are only experiencing moderate depression, and it's more situationally or environmentally factored. So doing a psychedelic-assisted psychotherapy is not going to touch something that's being caused or has an origin in more situational or environmental factors. So keep that in mind. This is not an intervention to automatically jump through. If you're sitting here and you're like, yeah, sometimes I get sad, this is not for you. Don't, go watch Hallmark movies or something. Now, there are different routes of administration when we're talking about ketamine. So the two most common are IV, intravenous, which is going inside your veins. The other is IM, intramuscular. So IV, I'll have a picture on the next slide. It's essentially, if you've ever had an IV put in your arm, it looks exactly like that. You're connected to a pump. It is the most common, and it is the safest because of titration. The medical professional in the room has full control of how much of the ketamine is coming into your system, and they can adjust it in real time. If things get a little too intense, we can dial it back, pull you a little bit back down to reality. If you're just floating on the surface, we can dial it a little heavier, go a little bit deeper. With IM, it is a series of 2 shots. So they give you one shot, you kind of like get up to here in terms of like the psychedelic experience. Then they give you the second one, and it bumps you up to here, and then you kind of float down. So that one is a little less difficult to titrate, because once you're up here and then you're up here, you really just have to ride the roller coaster. There's nothing you can do at that point. So all you have is your own devices or the medical or mental health professionals in the room, keeping you feel safe and grounded in that space. We also have intranasal administration through a nasal inhaler. That's the Spravato option. There's oral administration through lozenges, and then for you party animals, there is an anal suppository, but it's not actually as popular. I mean, if you want to do a special request, you can do that, but it's up there with lozenges where it's like not as potent, not as long-lasting. So this is kind of what it looks like in action. This is obviously not a real patient. This is more of a stock photo, but in terms of IV administration, it's typically a nice, comfortable environment, usually not a sofa like that. It's more of a recliner where you can actually feel the safetiness of being grounded and wrapped like in a little cocoon. Then you have the medical professional that's there monitoring vitals and administering the ketamine, and then you have the mental health professional guiding you through this experience. A typical appointment looks like you go in there and you do a quantitative assessment because you want to track progress, you want to see where you're doing in terms of how far you're along in your ketamine treatments, because it is an investment of time. The current statistic is it takes on average 6 sessions of ketamine-assisted psychotherapy before your symptoms go subclinical, which means they are no longer a significant impediment to your quality of life. So we want to be able to track progress. You would do a medical intake, making sure that you are physically fit enough to participate in a psychedelic experience. You go through a mental health intake to make sure that you are mentally ready and you are aware of the side effects and the risks and safety planning and all that fun stuff. You do the assessment to track progress. And then talking a little bit more about, with a psychedelic therapy like this, one of the benefits is being able to process traumas and triggers and all of that in an egoless state. So all of the parts of yourself that say, oh, that's too uncomfortable to talk about, oh, I don't feel safe enough to revisit that memory. Ketamine comes in and says, fuck that, and then it just makes you stare in the face of everything. So when we do that, sometimes there is catharsis, and you walk away with a sense of lightness and just a burden lifted off your shoulder. But sometimes that opens Pandora's box. So you want to talk about when you're starting a psychedelic therapy, sometimes you get a little bit worse before you get a little bit better. And sometimes you get really, really good, and then you have to kind of come down and find that sustainable therapeutic change. You set intentions. You don't want to just go out there and float off into space and other dimensions. You want to have a purpose for engaging in psychedelic therapies. Talk about the commitment, the attitudes, and expectations, because if you're going into this with a sense of like, this isn't going to work, or I just want to get high and not be depressed for 5 minutes, that is going to negatively impact the care. So just as much as we have that placebo effect, that phenomenon where a trusted medical provider gives you something and says, this is going to help you, and even though it's a sugar pill, you have that spontaneous remission, there is something on the other side of the scale, which is the nocebo effect. If someone were to tell you, here's this pill, but it's not going to work, or you go in thinking this is not going to work, your body's going to have that reaction as well. Not 100% of the time, just like the placebo effect isn't 100% of the time, but the nocebo effect is just as powerful as the placebo effect. So, quantitative assessment, check vitals, get plugged in, therapist comes in, talks about what you want to talk about, set an intention for this session, then the medical professional comes back in, flips the switch, we get high, but in clinical settings we call it the experience. And then the therapist is walking you through this. Usually the medical professional is also monitoring your vitals this time to make sure that you are both physically and mentally safe. And then we flip the switch off about 20 to 35 minutes, and then you return back to your body. Medical professional walks out, and then you and the mental health professional kind of debrief about anything that came up, any catharsis that you reached, or any level of aha moments that you might have had. The experience itself is a para-disassociative state. So earlier I mentioned that this is a disassociative state of amnesia, but that's the benefit of IV. And if you leave here and you're interested and you feel that you're a good candidate for ketamine, I would highly recommend the IV for the reasons I mentioned earlier. It's really easy to titrate, find that sweet spot, keep you plateaued there, and then bring down. Because if you fully disassociate, you fully have an out-of-body experience, you're floating in space talking to cats, that is not going to benefit you because you're not remembering any of the catharsis or any of those aha moments that you had in that egoless state. So the experience is a timeout from ordinary, usual mind relief from negativity and an openness to the expansiveness of mind with access to the self in a larger sense. And these effects enhance a patient's ability to engage in meaningful psychotherapy during and after administration. So during this space of non-judgment and egoless suspension, we have increased rapport, reduced defensiveness, evokes transpersonal experiences that aid in decision-making and support transformation. So all of that is a long-winded way of saying it increases neuroplasticity. So when we are going to psychotherapy, it is a long, arduous process because you have to change how you think about things. You have to change how you respond and react. You have to form new relationships with triggers, and all of that takes time. Time to unlearn patterns, time to develop new patterns. And what we're talking about is creating new neural pathways, and that is best done with neuroplasticity. It's kind of the difference between taking cold modeling clay and trying to sculpt something versus taking warm modeling clay and being able to do it a lot more easier because it's a lot more pliable. The brain works a very similar way. So under the influence of ketamine, it's almost like hitting the fast forward button on psychotherapy or therapeutic change. You're able to make these sustainable changes so much faster, so much easier, and so much more efficiently and effectively. The role of the therapist in this space, and there are options to go out there and receive ketamine treatments for mental health or physical health issues without having the therapist there. And I really don't recommend that because there's so much that can happen in that psychedelic space. You can go down some dark paths, you can have some what we call a bad trip, you might get triggered, and if there's no one there to kind of ground you, keep you in 1 foot in reality, or at least learn from that experience, you end up doing way more harm than good. So the role of the therapist is to establish intention. Why are we here? What do we want to accomplish? Ensure the patient's safety, guide the transformational experiences, provide comfort and assistance in navigating the stress, physical and psychological grounding, and then evoke that psychological insight. What can we learn from this? This does take a little bit of what we call contemporary psychoanalysis. And psychoanalysis has kind of that residual stigma attached to it, because Freud used to sit on his couch and say everything looked like a penis, right? For those of you that took Introduction to Psychology, you're well aware that Freud was obsessed with penises. But more contemporary psychoanalysis is making meaning of these abstract issues that have come up. So, if you have a history of active psychosis, active mania, you're on the autism spectrum disorder, cerebrovascular, cardiovascular diseases, from the seizures, severe liver disease, or pregnancy, then ketamine is not for you, and this will be what's called a contraindication. So side effects: disorientation, confusion, loss of motor coordination, dizziness, nausea, vomiting, increased blood pressure, changes in sensory perception. All of these are depending on dosages, but can be mitigated by a solid clinic. So the biggest issue with ketamine right now, in addition to the cost, is that there's no standardization of the field. There's no governing body. There's no one regulating it to say this is how you administer ketamine-assisted psychotherapy. So some people are overdosing, not intentionally, but some people are getting their patients to fully disassociate. There's no therapeutic value. Some people are administering ketamine without a mental health professional. So doing things like adding eye shades, music, recovery time, medical clearance, appropriate dosing, psychoeducation for the client and for the medical professional, all can mitigate a lot of these potential side effects. So current trends: diverse, unstandardized, and this is important because we saw a 500% growth between the years of 2015 and 2018. And I guarantee that number has at least doubled since then. So I don't know if you realize this whole pandemic thing really kicked a lot of people in the dick, so to speak. It's a clinical term. Look at it. So now what you're saying is, why is this not the new standard? Why is this not more of a cornerstone of mental health? This is still one of those fringe interventions that has a lot of stigma, judgment, misinformation. Well, part of that is the lack of FDA approval, which makes it very cost prohibitive. Insurance currently isn't covering it. Scheduling is very time consuming because the sessions can take upwards of 2 hours, maybe 3 hours if it takes you a little bit more time to come down. You have to schedule rides because you're not able to drive yourself afterwards. But there are cool companies coming up like Doc Rides. This is a student of mine founded this company out of San Antonio and has expanded to the Austin market. So if you are unable to drive yourself for medical appointments, they come do that. Standardizing the field, and then fighting the stigma and misinformation, which is probably the biggest contender. And as a psychotherapist, it is also something that we deal with on a daily basis. Like TikTok is the bane of my existence right now because there's so much bullshit that's just clouding people's minds of saying, oh, I don't need therapy, they're all brainwashers. So in fact, I'm so confident that I can guess the top 4 stigmas that you will toss out there about ketamine right now, that last week I wrote them on an envelope, and I will have a volunteer read them out loud. So before we do that, before I practice my mind reading skills, what are reasons that you've heard as to not do ketamine-assisted psychotherapy? What was it?
Dangerous.
It's dangerous. What else?
For horses.
It's for horses. It's a horse tranquilizer. 2 more.
Addiction.
You might get addicted to it.
It's lazy.
It's lazy. It's taking the shortcut. I need to do the work myself. All right, so Mackenzie is going to come be our volunteer and just show how strong my brain reading powers are. So if you can read that list out loud.
Great. We got Dearest Princess Butt Muffins. These have been the happiest 7 days of my life. I am sorry the passing of your grandfather put a damper on things last weekend. I'm sure me saying let's do it in his honor didn't help. Anyways, happy Valentine's Day. Yes, I was right. It does happen to most men. I looked it up and it's 52%, which is more than average.
Okay, so this explains so many unanswered phone calls between me and probably now my ex-girlfriend, but which also means she just received a letter that says horse tranquilizers, it's dangerous, it's addictive, people are going to judge you. So well, this is awkward. But horse tranquilizer, let's talk about that for a second. That's not really a good reason, right? Because in the Venn diagram of things that horses do that we also do, we both eat, we both drink, we both procreate, we both play, we both love and bond, we both learn. In fact, the only thing that horses really do that we don't do is poop outside. And I know that we're in Austin and there's hippies in the audience, but there is a qualifier, poop outside with confidence, right? Towards people, we pay taxes, get divorced, have existential crisis, drunk dialysis, and we poop inside with shame. In terms of what people and horses consume, I mean, we all eat grains, oats, fruits and vegetables, and salts and minerals. This is both things that we consume, but we don't have any stigma around these things. In fact, the only things that horses eat that we don't is hay and grass, and we actually can, we just don't, right? But people, eat most things that horses don't. But the fact that it's a horse tranquilizer, these are also things that we share medically with horses. Horses use the same antidepressants that we do. That is a sad taco because know your audience. Tramadol is a pain management or anti-inflammatory pain management. We use the same chemotherapy. We use the same thyroid meds. I couldn't find a non-stigmatizing picture of thyroid issues, so just imagine all of these people having thyroid issues. And amoxicillin, and if you're wondering why amoxicillin sounds familiar, because it was this dope-ass pink stuff that we all drank as child. In fact, this is such a cultural experience that you can get lapel pins that just has this amoxicillin on it. So yeah, get on Amazon. But the fact that it's a drug is true, right? Because all medicines are drugs. But the qualifier is not all drugs are medicines. It's one of those, all squares are rectangles, but not all rectangles are squares. Or my favorite, all dolphins are whales, but not all whales are dolphins. So yes, it is a drug, but that label means nothing. Because the definition for medicine and drugs is the exact same. The definition for medicine and recreational drugs is different. Because medicines are chemicals or compounds used to cure, halt, or prevent diseases, ease symptoms, or help in the diagnosis of infirmity. Versus recreational drugs is a drug taken for enjoyment rather than medicinal purposes. So really the only difference that we're talking about here is intention. What is the intention of the use? What will people think of me being judged for participating in a psychedelic therapy? Well, one, fuck, I'm doctor's orders because Dr. Patrick said so. Keep in mind, I'm not the cool kind of doctor that makes a lot of money. I'm the nerdy kind that owes a lot of money. Still, fuck him. You are in charge of your life, and you get to decide who and what you share. Because are you sharing all of your weird bedroom stuff with your family? Are you telling them all of your weird 6th Street stories? Chances no. So you don't owe them this information about your own treatment, your own path to health. If they want to have an adverse judgment or reaction to that, that's on them. That is not your problem. This is your health that you're talking about. Drugs are addictive, which is true. Some drugs are addictive. But ketamine, it has the lowest dependence potential in terms of, not the lowest, it has a low dependency potential. And really that only potential comes down to what we call cognitive addictions. So there's the obvious chemical addictions that come from drugs and alcohol. But the cognitive addiction is that window that covers gambling addiction, gaming addiction, sex addiction. Because you can be addicted to the sense of something. You can be addicted to the idea of something. That's what we call cognitive addiction. So yes, there is a potential that you just love floating out in space. But it is, I'll remind you, used in addictions treatment. It is a safe alternative to other forms of addiction treatment. So if you're leaving here and you are still convinced you want to participate in ketamine-assisted psychotherapy, there's things to look out for. Look for reviews of the clinic. Look how long the clinic has been open, because the field is unstandardized, anybody that's licensed to administer ketamine as a medical professional can open a boutique ketamine clinic. So you see some that are just loading people up with ketamine, giving them a high five, and then kicking them out the doors. There's no therapeutic value or benefit to those. So read the reviews, how long have they been open, really emphasize the integrated psychotherapy part, because you need a guide on this experience for it to be beneficial and to have sustainable change addressing mental health issues. Avoid any sales pitches or bundles. Like, this should not be a gig economy. This should not be like a spa package type deal. This is still medical care. I know that mental health and medical, we tend to keep those kind of siloed from each other, but the body is a whole, so it needs to be treated as such. Feel free to always do a consult call. Like you can always call and ask what the procedure is like, what the resources are, all of these questions, and then make sure they have integrated sessions. So for that, I will now open it up for any of you that have any questions about ketamine, my life choices, or...
All right, cool. So floor is open. Who wants to kick us off? All right. This is great. Okay, we're going to start back here. What is your question? And just, this is not about you, this is a general statement. Please make your questions questions and not assertions or commentaries or tangents. We good? All right. So, no pressure.
So you mentioned the cost can be a prohibitive factor. What is the actual like dollar figure for an individual or like comprehensive treatment somebody would have to pay?
You're talking like recreationally or medical? Yeah. So when we say, I should have mentioned this earlier, so when we're looking at cost, I think the cheapest I've seen in Austin is $400 to $450 up to $900. That should be the sweet spot, with $700 being the average. If you're looking at anything over $900, there are other options to do that. There's also a lot of interest from the federal government in terms of VA clinics. So if you're a veteran, chances are you can find a funded program to receive those services. But yeah, between $500 and $900.
All right, we're off to a good start. That was a good question. So we have a question here that's from Twitter. Any thoughts or studies on mescaline and peyote? And maybe a quick whether or not you can get that kind of discussion might be good.
Mescaline and peyote is another one of those kind of fringe. So I gave the list of what's actively being researched, and then there's kind of like the fringe underground research that is a real thing. Those I can't really speak to because that's not my academic background. I'm not too familiar with those. I will say that there, and this is not me saying like you should go do it or find these places. I'm just recognizing that there is an underground psychedelic world of like guides and things. Like they even have, you can find like whole entire websites. I don't know how they do it without getting busted, but you can find like these retreats, or you can go on what's called a medical vacation, where you go to other countries where it is legal and you participate in these type of ceremonies. But things I would words of caution is like, you don't know where it's coming from, you don't know the potency, you don't know if the potency is standardized. If you have an adverse reaction, are you in a country that can tend to your acute needs? So my recommendation would be stick with what's been evidence-based and has passed this far in FDA approval, and just be patient for the rest, because it arguably will happen in the next 2 or 3 years.
All right, so we had some hands up earlier. Who has another question? All right, what you got? Thank you.
Is the reason that you cannot like experiment with this if you have like autism because of a lack of study, or is it because there is a negative impact? Are other neurodivergent people also excluded from this?
Super good question. So neurodivergence has become one of those like hot button topics where it's like easy to say no than find the degrees of acceptance. So it is not completely contraindicated in neurodivergent populations such as autism spectrum disorder. It just depends on the level of severity or where on the spectrum that they are at. Mostly because in psychedelic spaces it's so much abstraction, images, colors, pictures, memories, and stuff like that, that it is difficult for a neurodiverse brain to benefit from that or kind of process that. So it can be just overstimulation to this instance, because it is auditory, visual, sometimes even tactile hallucinations as part of that, which would be too overstimulating for some. So it's not a complete no. Just like mania. Like people can have a history of mania, they just can't be active mania. But yeah, it's a very good question.
Okay, so we've got someone in the center of the crowd here. All right. Here you go.
Is it common or required for psychotherapists who are administering to have the experience themselves? Anyone's
Well, I'm asking questions. Okay. I'm just happy that I know the answers. So, is it important for the therapist to have experienced ketamine themselves? It depends on who you ask. Personally, no, because right now the current research, keep in mind, this isn't new by any means. We've been studying ketamine for mental health purposes since the 70s. It's just gotten popular and it's been decriminalized and legalized in recent years. So of that, there's only very few things that have been found that the therapist needs to do, which is have familiarity with safety and grounding, walking them through the discomfort, setting intentions, and helping them process like abstract things that are experienced during the session. So therapeutic orientation, how they do it, what they do is kind of irrelevant as long as those factors are there. As far as having that personal experience, it really depends who you ask. There are some training, there's a lot of predatory trainings that advertise, are you a therapist? Come get certified in ketamine-assisted psychotherapy. And essentially what you're paying is $6,000 to go get high in California 4 times, be with a bunch of hippies, and then come back. Like, there's not a lot of therapy training in that. They just think that the therapy training comes from participating. And there is some value, but that, to me, that creates the opportunity for bias. Because you have your experience, your client's not going to have the exact same experience. So I've seen medical professionals intervene when I'm doing my job in there, trying to offer guidance based on their experience that's not relevant to what the client is doing. So it does have insight into the intensity of the experience, but it can produce that bias in there. But it also, can empathize. But at the end of the day, to work with PTSD, a therapist doesn't have to experience PTSD. In order to work with bipolar populations, a therapist doesn't have to be bipolar. Does it help? Yes and no. It just kind of depends. But yeah, I think overall, it just depends on the therapist and how much they can compartmentalize their experience from the client's experience.
All right, I think we have time for one more question. So I'm going to need a high quality question from somebody here. All right. You're showing a lot of self-belief, so I'm going to go in this direction. All right, what do you have?
I was curious, because you talked about the therapist being able to talk to the patient like during the experience or the trip, but then there's also the integrative session afterwards. Like, how much interaction is there actually with other people verbally during an experience like this, or is it mostly saved for processing like after you come down?
Finally got our first bad question. No, I'm just kidding. That is a very good question. How fast can I get the crowd to turn on? No, so it is a good question, because if you've ever done a psychedelic drug, depending on the dosage, you might have just stared at your refrigerator for 6 hours and didn't move at all, right? It depends on the client. It's very individualized. When I'm doing the intake with the client, I'm explaining typically one of 3 things happen. Either you are completely internally focused, so even with the appropriate dosage, you're just so enamored with what's going on that you're just choosing not to really have that one foot in reality, one foot out. You can if you needed to. So they'll respond to prompts, they'll answer questions from the therapist, like, is this too intense? How are you feeling? But there's not a lot of conversation going on after that. So that's on one side. The other end of the spectrum, they're just chatty Cathy's the whole time. You wouldn't even know that they're under the influence of ketamine. Maybe they've had a lot of prior experience recreationally and they just built up a tolerance, or their bodies just metabolize it differently, so they're not experiencing the full effects of psychedelics. So it is just like a regular therapy session, but most people are in the middle. It's kind of one foot in, one foot out. They're floating in space, they're looking at dragons, they're doing stuff, but they can still kind of process things in the moment. What does the dragon mean? How do you feel about it? All that kind of things. But yeah, the real processing mostly happens at the end of it. But there's no real benefit to either one, or to any of the 3. Like I said, most people are in the middle. The most important thing is just keeping them feeling safe and grounded and supported during that time, because there's not a lot of change happening. You might reground them to their intention of, I want to know why I freak out every time I pee in public restrooms. So it's like, yeah, so let's just talk about the last time you peed in a public restroom. I don't know, this isn't a real case like this person. So you can pull them back to that, but really the therapeutic value, the hardcore nitty-gritty stuff is once the pump is off, they're getting reoriented to their bodies, and then that processing that happens afterwards, and what we call integration sessions, which is usually in between. So you would want to do, ideally, 1 week on ketamine, 1 week off integration session where it's just psychotherapy, 1 week on, 1 week off. Some people want to power through and just do all of their ketamine sessions back to back, which is fine, because time's a thing, money's a thing, but ideally you'd want to kind of space it out.
All right, great. All right, y'all, that was a great talk. Let's give them a round of applause.